welcome back to the Fried Eggs podcast. It is just me today because Amy is on a little bit of a vacation, but we are so excited to be joined by the co-authors. I'm not sure what the correct terminology is, but both of them wrote the Cycle book, which is just an incredible resource that I don't know why it has not existed before, actually. Like, I'm very 2026 and we're finally realizing like we need a cycle tracking Bible of sorts so that we can get away from the apps, get away from our phones. So we're just so excited to have you both here. So welcome.
Thank you so much for having us. We're so excited to be here.
I would love to start by having you both just introduce yourself to listeners. This is an infertility and IVF specific podcast, but you both do very different work and work that I think also relates to people who are going through infertility and IVF in very different ways. And then we're also going to talk about the Cycle book and what it can offer to listeners. But I'd love to just open the floor and have you both kind of share a little bit about yourselves.
Go for it, Morgan.
All right, I'll start us out. I'm Morgan Miller. I am a certified professional midwife and a lactation consultant. I am actively practicing as a midwife, so I do the whole birth baby thing. I have a birth center here in Maine, but a big chunk of the care that I offer is also around preconception and fertility support with people. So that's a huge part of my practice as well. I would say the way my practice functions is heavily based on the personal experiences I've had in healthcare, which have also ultimately really been a huge piece of this project that Laura and I are doing. But my own experiences with endometriosis, my experiences in accessing abortion care when I was in my 20s, and just, the things that a lot of your listeners are familiar with, which is not being afforded a ton of information growing up about our bodies, and then not being able to access good educational information, even through healthcare providers. And then unfortunately, that repetitive storyline of dismissal from providers when we're trying to understand what it is that's happening in our bodies. So that's really steered what I have leaned into in my career, and what I'm hoping to do with clients is really set up a space where we can get good information to people. And I think Laura and I's general goal is to try and get it to people before the crisis, like have this information afforded to us earlier on. Laura, you have such a different background, but it's so gorgeously aligned.
Yeah.
Well, Morgan is amazing, and I'm really lucky to have been friends with Morgan for decades at this point. But Morgan has been a part of my care many times as a friend, but also as a professional. And it was when I was dealing with infertility myself that Morgan began teaching me about my body and teaching me about cycle tracking and helping me understand what was actually going on so that I could better navigate the system and learn how to advocate for myself. And it's really incredible, the work that she does. And so it's really wild that we still just have so many gaps in the amount of information we have about our own bodies. I'm Laura. I'm a certified sex therapist in private practice. And similarly, I have had a lot of questions about my own experience throughout the years. I have PMDD. So there's a connection between like the mental health component there, as well as like what it's like to be in my body during different hormonal phases and trying to understand that hormonal sensitivity and what that looks like for me in relationships and across the board. But for me, the hope that I have in all of the work that I'm doing and what brought me to the idea of sex therapy in general is this feeling that there's a freedom that we can all potentially access when we have enough information to make really informed choices for ourselves, and we don't feel scared in the same way that we did when our bodies and our desires were a mystery to us. And so for me, the hope that I have in the work that I'm doing as a sex therapist and in the collaborative work that Morgan and I do together is that we're taking some of the fear away, because I know how hard that fear and that shame can be, and how we understand who we are and what we want out of this life.
That's amazing. Yeah. As you both were talking, I was thinking about how I feel like healthcare has come so far, but also to have these different options or these different, I don't want to call them niche healthcare needs, but you don't just need your doctor, right? There are different different resources like having a midwife or having a sex therapist to be able to like meet some of these problems or concerns that you may have that like your traditional doctor, like in the past, we would have just brought it up with our doctor and they would have been like, okay, well, here's a very textbook answer or response. But like, no, there are actual professionals out there that can help with some of these more very specific concerns that have been just misdiagnosed or overlooked for so long. So I think it's just incredible work that you're both doing. And I'm very grateful that those professions exist now and that we have more access to them. I would love to transition to talking about the cycle book, which, okay, first of all, I just followed your graphic designer on Instagram because it's so good. Like,
I know. She's so
I want to
good.
have a whole conversation about how you found her and all of that. But first,
Yeah.
can you tell us a little bit about the cycle book and how you came to write it together, and also just kind of the moment that was like, this needs to exist. Why doesn't this exist yet? Let's write it.
I mean, that was really it. Like Laura and I, just like she said, we like grew up in our 20s together and figuring out our bodies and like all the things. And then we became our respective professions. And the friendship we had honestly expanded our careers because it meant that I got to consult with a sex therapist who's incredibly informed for all of my midwifery practice clients, and realized like this giant disconnect. Medical care is so siloed. We all know that, anybody who's in it. But this basic concept of the awareness of what's mentally happening and physically happening in our bodies in the context of hormones, there's nothing out there. Nobody is connecting that. There was no tool for us to give our clients. So we were constantly referring to each other, consulting with each other. We had shared clients and needed this functional tool to be able to put into practice things that we knew worked, that we knew we could understand hormones. We knew that people don't have to necessarily see an endocrinologist to understand them. They have the capacity to have that knowledge themselves. And it was really truly out of like dire frustration and necessity that Laura was like, Morgan, we need to do this.
We need to do something about it.
It's true. I mean, when you said I can't believe this doesn't exist, it is actually shocking. And we tried everything in terms of what we could refer people to before it truly was just being so frustrated that we had nothing, that we decided to try to make it ourselves. And I think that there is a piece of the hormonal tracking, which still has a lot of, I think, like negative association with it. And I'm so glad you like the design, because a huge part of what we're trying to do with this project is to also say it doesn't have to be terrible homework and boring or associated with something really negative and like a, terrible challenge that you have to overcome. But like maybe we can make this just like routine and also beautiful and like, I don't know, just like a general piece of like self-awareness, like we would with anything else, that you can just have it on your coffee table and have that be normal, is like a huge part of what we're hoping to achieve here.
I mean, we put so much into the functionality of this tool, but I love that you call out the design, because just like Laura's saying, like it only works if it's pleasurable to do and feels good to experience, and you actually get useful information from it. So there's so much that went into that functionality, that this be a joyful experience for people to not only, of course, read the content that's in there for a great grounding experience, but to actually do the cycle tracking. It should feel good and nice and fun and playful, and I feel like we got there.
That is definitely what comes to mind, is like fun and playful. And it's something that Amy and I talk about a lot, because a lot of the materials that are offered specifically in women's healthcare when it comes to books or online content, it's very like pastel and like minimalist and monochrome, and like this is fun and it's like retro, and just it makes you feel good to pick it up and to look through it. And so I think that's good. Well done on the cover. I definitely love it. So I want to get into what is actually in this book. There's a lot. I think when people think about cycle tracking, especially in like when we're talking about fertility, right? And trying to conceive and in those beginning stages when you're trying to just get familiar with your cycle, get familiar with your ovulation window, we rely on these apps. That's kind of just what we're pointed towards. And Morgan, I believe it was on a podcast that I recently listened to that you were on where you were talking about how these apps are actually like fairly inaccurate. Can you tell us more about that and also like how the cycle book is solving this problem or helping people get a better look at their specific cycle and figuring out more accurate data?
Yeah, it truly is. I think like Laura and I are just constantly upset every day by this. But unfortunately, the research is really showing that apps are not good at predicting really important phases of the cycle, particularly things like ovulation. So, particularly for your listeners, understanding that the research is showing it's about 20% efficacy for predicting the ovulatory phase. 20 to 21%, like that is not very good, you guys. And I am talking about the fancy ones, the fancy apps and the things that are expensive.
The
and
ones
I
you
know
pay
what
for,
you guys,
yeah.
I know them. People walk into my office every day and they're like, hey, I can't figure out why we haven't conceived. I've been doing everything right. I've been following the rules. I paid for the thing. I have 5 years of this data. And the part that I think is the most gut wrenching for me is that it doesn't take long to look at that data and see that it's inaccurate. It's usually something we're able to assess in like 2 minutes of our hour-long visits to just glance at that and say, yes, yes, but that app has been telling you the wrong window. And so all those times when you've been timing conception or timing an insemination have been in the wrong window. And that is devastating for people to learn and that's the worst part of the visit to say, I think that might be our first place to look in the glitch is that timing is simply off. And the part is that the apps can't get the functionality of the individuality of ovulation. The cool part about the menstrual cycle is it is so responsive to the world we live in. It's not just what's happening inside our bodies. And so your body is really smart on timing its hormones and things like ovulation in moments of safety and convenience. And so ovulation changes every cycle. It's not always the same time. And the apps can't quite get that in their algorithm just yet. But it doesn't mean that that information is too hard for you to get in other ways. You can get it. It's fairly accessible. It just takes understanding a couple different biomarkers and those like signals in yourself.
Like you're talking about somebody who might come in and they're realizing that their ovulation window has actually been incorrect. What are some of those like flags or markers that you would see that when they begin tracking analog that it would reveal essentially?
Yeah. So the apps are still using algorithms that are rhythm based, which looks like an averaging of data and creating a prediction based on that averaging. And most of the time, they are still basing that on all menstruating people, not just you as an individual. And even when you can toggle all the back end things in the apps to say, no, I just want it to be me, that's still averaging all of your life experiences. It's not you, the individual today. Like that is the thing that the glitch is missing. So what Laura and I are talking about is looking at the really basic biomarkers that a lot of these apps do look at, looking at things like basal body temperature that's really reflective of the luteal phase and what's happening with progesterone in the body. Also looking at things like body fluid, looking at cervical fluid, which is a really wonderful marker of what happens in the beginning of an ovulatory phase. And then really starting to triangulate that data in the context of other body signals that are happening so that you can see the beginning of a phase as well as the cap and the end of it and be able to link it to other body signals that are happening so that even if you know, yeah, sure, I ovulated last cycle on day 12 and the cycle before that was day 13, I know that because I have this particular body signal right now, I think I'm ovulating earlier. I'm day 11 this cycle. You can still have that biofeedback without having to have that kind of averaging of what's happened in the past. It's more about the pattern recognition of these signals in your body and what happens every time you have that cervical fluid present. What happens in the context of your temperature elevating in the luteal phase.
Morgan will often have clients also utilize other more kind of analog tools like, LH strips, things like this to like be building the data points that a person has. But we're also trying to expand some of these data points to include things that would be specific to each person. So maybe it's an emotional feeling that you have around ovulation. Really classic symptoms around ovulation are around arousal and desire and like wanting of sexual connection, just like baseline turned on horniness that a person is experiencing. That's not the same for every person. That is common. But being able to notice other signals in your body so that once you have a sense through tracking of what your kind of combo is here, along with those really solid biomarkers, where you really have a sense of picking up the signals and then the ways to confirm that through those biomarkers. But really expanding this so that it doesn't again feel like a mystery that you have to look outside of yourself to gain data on, but the feeling that you can just kind of get to know yourself and then recognize, oh yeah, that's probably what's happening again, and then do everything that you want to do to confirm that, and then kind of move forward. And I mean, people pick up on the signals very, very quickly, and it becomes second nature, really.
And it's so helpful to use these like expansive ideas of what's happening in the body, particularly when trying to conceive, when like it gets stressful so quick and people are like, guess what? I know I used to feel horny then, but I sure as shit don't feel it now. All I am is stressed out. And it's like being able to identify these other grounding factors in the body to be like, it's okay that it doesn't feel like the perfect magical moment for me and my partnership. I still know that this thing is happening in my body and I can still move forward in confidence however I want to on this journey. Like it's getting bigger than just those biomarkers of the temperatures and the cervical fluid and the LH. It's like, how do you feel in your body?
Yeah, it's very empowering. There's a whole section in the book about what you can track and cues to look for. And I think it just, like you were saying, these are things that we know already, but you're putting language to it and you're giving us a way to recognize like, oh, this is a repetitive feeling. This is something that I feel every single month. And now I know what my body is doing in response to this feeling. And I think that's something that women, we know, but we're almost like gaslit into not thinking about those things and just thinking like, oh, we're hormonal. Oh, we're PMS. This is just, they're not cues. They're just like almost like nuisances like throughout our cycle. Yeah. And so, I think it's just like really empowering to have those cues to consider and to look for. Laura, I want to talk about the pleasure chapter because it's a really overlooked component when it comes to trying to conceive. Things can become very routine, very like the spark is removed, the intimacy is removed. Even if speaking from my own experience here, like even if you try to keep the pleasure and the intimacy involved, like it can become very overwhelming very quickly. And then it's just we got to get the deed done. Like we've got to we're trying to have a baby here. And then the longer that you try without success, the harder and harder it becomes to tap into that pleasure and keep it within the relationship. So I would love to have you talk a little bit about pleasure and why you decided to include that in the book.
What you're sharing is something I hear all of the time and something I can relate to myself. And when we think about the ways that we kind of gaslight ourselves, I think that the experience of wanting your body to do something that it's not doing is one that disconnects us from our body, just honestly out of necessity, because it's too painful sometimes to be continuously connected with a body that is not doing the thing that we desire it to do the most. And it can be really hard for pleasure to be a part of that. And so our intention with the pleasure chapter was to expand the idea of pleasure so that we're not just talking about the type of sexual pleasure that we associate with a uncomplicated, straightforward sexual experience, but to talk about all of the other parts of our bodies that we can be connected to, that feel good, that we feel pleasure around. And when I talk to people I'm working with, when I reflect back on my own experiences, when I'm approaching the idea of like ovulation sex, like sex to get pregnant when you can't get pregnant. I like to remind us that it's okay that we have a bunch of different types of sex, and it doesn't mean that like one is better than the other. It's just that they're different. And instead of looking at it as like a sort of like vertical hierarchy, I like to say like, let's look at this as like a buffet of a number of different types of sex that
Love
we
that.
get to
Love
have,
that.
right? Like, you know, you have had like a quickie before, you've had like sex that was longer, you had a night where, you know, you got like kinkier than you thought you were going to get, and that was whatever it ended up being. Like, we've all had different types of sex, and this is another type of sex. And it doesn't mean that it is inherently bad. It doesn't mean that it's something that we have to be worried about in the ways that sometimes I think we feel pressure to be. And it also doesn't have to be like a loss. It can just be like, this is where we're at right now. And so what is pleasurable about this for me today? I think humor is really important in a lot of these moments, like the absurdity of it all. My partner and I, there was, you go through so many stages of different providers recommending different things in your journey, and one of the earlier recommendations from, I can't recall which provider it was. It must have been a naturopath of some sort that we saw at one point. And the recommendation was you have sex every other day for like 6 months or something like this. And we had been together for many years at that point, and the insanity
Of that.
of having sex every other day with someone that you've already been having sex with for so many years for 6 months is, I mean, the closeness that I think we experience as a result of that has nothing to do with sexual pleasure and everything to do with a moment of just this sheer absurdity of this thing that
Yeah.
you are trying to do with another person. And that is not the type of sex out of my buffet that I would choose to be having currently, but it was a type of sex that I had at that moment in time. And so I think that there's something really powerful about being able to identify what did actually feel good about that for me, what was pleasure for me in that moment. And what Morgan and I advocate for is every cycle that you're tracking, include at least one type of pleasure that feels reasonably accessible to you, so that we're not only wired to notice all of the things that aren't working for us, but we're also intentionally thinking about some of the things that are. And it actually does make kind of a big difference.
Yeah, you're flipping the script. You're focusing on finding the thing that does feel good instead of focusing on what might be missing. I love that. For people with irregular cycles and people going through IVF, and also bringing this to your doctor's appointments, or using this as data with your fertility clinic or your OBGYN if you're just starting to realize that maybe you need intervention. Can you talk about how the book works for those people and how they can utilize it?
We really set things up to make sure that this information is the reader's information. Like, their cycle book is their information for them to use, and we want them to know that they are the expert. That's always true. And if you have a provider who doesn't think that you're the expert, then switch providers if you can, because no one is going to know your experience of your body better than you. Yes, you may work with multiple providers where you're trying to pull on their expertise, but you are still the expert of you. So we set up each cycle where you're tracking your data and inputting all of that in there with a following page to help you break it down so that you know exactly what it means there, and you can walk in really armed and ready to get information out of a visit. We have a really nice worksheet at the end of the book so that you can really, filter down that information, because Laura and I are also providers who like chose to go private practice because we want more time with people, but we realize we're like in a world of a broken healthcare system. You maybe have 5 minutes to talk to somebody. How can you get that information condensed down in a way to get whatever it is you're trying to get, whether it's fertility support, a diagnosis, a new prescription, a new birth control, whatever that might be, to break down that information so that you can really use it in a way where you're not like, hey, provider I just met and have 3 minutes with, can I show you this like giant journal I have with all this information? Or can I scroll through my app with you for all this amount of time? Most providers, like, I don't actually have time for any of that. But to really condense it and make it useful to say, this is a pattern I've recognized. I'm aware it's associated with this phase. I know this is a common misdiagnosis around this. I want to come to you for this, whether it's like diagnosis or a prescription or whatever it might be.
Mm-hmm. Yeah, what's the main question you have going into that appointment, and trying to, if you have information that you want to share around what you already know about like the background of that question, how can you synthesize that really quickly? There's so many amazing providers out there who truly only have 5 to 7 minutes to be with you. And like, how can you both maximize that time? That's like really what we're hoping for. And, we see people use this data and the process of this in any stage, including, people who are going through IVF. We often have these moments where everyone has a question and you want to have a little bit of information about yourself ready to go into that appointment with. And so it's just also kind of like getting us in the mindset of how to actually navigate some of these appointments. Because if we go in just sort of like open with, no real agenda, we have a hope that like something is going to happen in the way that we want it to, but no strategy, honestly, we're going to get chewed up and spit out a little bit. I hope that doesn't sound callous, but we believe you need a strategy to get where you'd like to go, especially in these areas that we know are under-researched and often underfunded.
Yeah, I mean, I think it's a real hard truth and something that a lot of us learn, especially when we're going to multiple doctor's appointments and seeing multiple providers, realizing that you do kind of have to become your own advocate. Like if you have questions that you need answered, you need to know what those questions are and how to ask them. And one of the things that I appreciate about this book that I didn't mention earlier, but I should say, is that it also teaches you about your hormones. Like I think with a lot of the apps, like it's just tracking the cycle, but it's not really understanding like what does LH do? What does progesterone do? And so I think giving people also that knowledge so that they can better have conversations with their providers and understand exactly what they're asking or what some of these problems might be is really powerful. I'm curious, I'm assuming you've gotten really great feedback about this already, but I'm curious about any feedback you've had from people who have used the information from this book and their knowledge that they've gained from this book in conversations with providers and how that's gone for them.
I mean, truthfully, it's so delightful. It's like the dream come
I'm
true.
sure.
I mean, it was our goal in making it, but the feedback that we're getting, it like makes me cry every time. But it's like I figured something out. Like I saw so many people. I tried so hard and I finally figured it out. Or the validation of like I knew it. Those are the ones that get me every time.
Yeah. It's getting the diagnosis. We hear all the time from people with PCOS and endo and people navigating a bunch of different fertility concerns, people with PMDD, people who have ADHD and never understood how their cycle affected it, for example, people who didn't know that you could change your medication in like the luteal phase to maximize for whatever chronic condition you're managing, how you like feel. I mean, like really people just the unlock that this is like a pattern and there's so much that they can actually do once they get that information. Also, the thing that no one knows, this is not really going to apply to your listeners who are going to really know what ovulation is, but no one knows what ovulation is. They don't know. And I mean, I'm sure my experience of this was not having to learn it really until I was dealing with infertility and being so furious that nobody taught me about it earlier and not understanding this about myself and finding that just accessing accurate information about such a straightforward cycle phase was nearly impossible, right? But when people are like, oh, I didn't know that it wasn't just disgusting discharge, right? There's so much stigma and shame, but actually this is my body communicating something. I mean, these are things, this is information we should all have, you know?
And I think that's what I'm like seeing with fertility clients is that it can, as soon as they start to have that grounding and understanding, there's so much learning about overall health. Like it's bigger than fertility. It's bigger than pregnancy. There's so much we start to learn about the body when we start to conceptualize these hormones and these signals as being affected in all of our body systems. Like you have receptors everywhere. So realizing like
Yeah.
the cognitive changes and all of these things make sense. There's so much grounding in having that understanding. And it like just is like a happenstance that happens with fertility care. That's really cool.
Yeah, I was thinking about, Morgan, how you said earlier, it's devastating when you have a patient come in and there's the realization of, hey, you've been using this app for so long and you actually like the window is incorrect. But I can also imagine that there is, like we're talking about, some relief with that of like, oh, I now have an answer to this problem, right? And Amy and I talk about this on the podcast of like unexplained infertility is one of the like most devastating diagnoses because you don't have any answers. And I think that's why so many women, especially when they get diagnosed with endo for the first time, it's like, I knew, like I always knew there was something wrong. And now I finally am getting that confirmation and that answer. And so at least now we can move forward with that knowledge, right? Rather than just like, we still don't know. We don't know what's going on. We don't know what's wrong. And so I think having access to that kind of information to be able to figure out really like what is your body telling you and how is it communicating? And Laura, you were making me think of like, I mean, I was 29 when we first started thinking about trying to conceive and I got my IUD removed. I had no idea when ovulation occurred. I didn't know why I had an IUD. I just knew I have an IUD to not get pregnant. I think I ovulate before or after my period. Like, I'm not really sure like what my period's in response to. And I'm almost 30 years old. And it's just like the information was never offered to me. I had to go looking for it. And so I think that's a really unfortunate point that you bring up, but something that a lot of us can resonate with.
Yeah, it's wild.
And it makes me mad. It's like,
Yeah.
how are we still here? Okay, well, one thing that I did want to bring up, because I'm a very type A person, and this is the kind of thing that if I had this at the beginning of my infertility journey, I would have consumed it and carried it with me everywhere, which is a really good thing. But also, for any patients that you've seen where tracking has become a little bit obsessive or where it is becoming all-consuming, what are some things that you see that might be like signs that it's time to take a break or it's time to kind of put the tracking aside and reset because this is becoming maybe not as helpful anymore?
Oh my God, this is such a good question. And outside of even trying to just like when you're in the state of really trying to solve a problem, outside of like the hyper focus that some people get with that, there are also some of us whose minds tend to be hyper focused and obsessive, and for this to become something that is too big and too consuming. And what we like to do in these moments is to limit the amount of categories that are being tracked. And actually, we only gave a certain amount of lines in the book for the amount of categories that can be tracked, quite literally for that reason. Something that we really like to also focus on when we're talking about the physical checking of the body signals is to, as much as we can when we're working with someone, keep that very neutral in the observation and quite brief in its observation. And so by that, I mean, literally the signals where we're like, oh my God, like, how did my boobs feel today? How did my cramping feel today? What did I notice when I was, kind of moving through the world? Was that a pang of something? And we're really spending so much time in that somatic physical checking cycle. And we like to use some kind of like mindfulness based techniques here. And so when you're feeling like you need to notice that thing in your body, just imagine that as I see the thought and I'm just letting it float by. I'm not engaging with it. I'm not digging into it. I'm not repeating it. I am accepting it and then releasing it. And so I'm like, I love like the blue sky mind. Like your mind is a blue sky and the thought is a tiny cloud and the cloud floats across the sky and, the breeze carries it away. And then when we need to do that checking again, it's the same thing. It's a little cloud and it sort of like floats on by. But really we're practicing noticing, trying to decrease the amount of that checking that we're doing and keeping it really contained so that it doesn't become so overwhelming because it feels like we're doing something necessary and productive and helpful. And then all of a sudden we cannot get out of that cycle and we're stuck in it. And so we're really trying to minimize, refrain from doing that, keep things nice and contained so that we can do what we want to do to take care of ourselves, but we're not like losing our minds in the process.
Yeah.
I don't know if any of that resonates as type A.
That 100% resonates. It's very practical. Like those are I'm like, oh, I can do that. Those are very simple, straightforward steps. They're instructions, right? Rather than just like, take a break, go on a vacation, like just forget about all of it. It's like, no, like here are some ways to move forward practically. And I think that that's really, really helpful. So thank you. Before we transition to talking a little bit more about sex and also about your work as a midwife, Morgan, I want to finish talking about cycle tracking by talking about privacy because it's such a huge concern right now. Can you just talk a little bit about how this is a way to protect your own data and the benefits that come with taking that offline and no longer having it in apps?
Yeah, we actually, when we were coming up with this project, trying to create a tool, Laura and I, of course, were like, we want to get this out in as many hands as possible. And what are in people's hands? Their phones. So we went down the app route. We went through beta testing. We really did try that route. But unfortunately, in that process and learning, had the realization that it is simply not a safe place for that data to be stored. There are not those privacy protection laws that people are familiar with their healthcare providers, things like HIPAA that protect that data. And we know now that this data is privately owned, being bought and sold. It is being called upon in court cases and in many, many places around the world. This type of information is simply not safe to be in those spaces and can be quite dangerous to be in other people's hands.
And also to name that as people are using AI more frequently, and as people are utilizing chatbots and large language models like ChatGPT, for example, we have even less privacy when it comes to the information and the personal health information that we're putting out into those spaces. And what we also kind of know about how some of these large language models work is that they're like using the data to train themselves. And so it's really unclear as like an average consumer, like where that data is going and where that health data is going and what it's being used for. So beyond like third-party data brokers, like with the apps, like the whole AI of it all is like another sort of like abyss of unknowns around what's happening with our health data. And, it's maybe important to you, maybe not as important to you, but I think just being aware as a consumer that there's a lot that your data is like really useful for, and your health data is actually extremely valuable to a number of like pretty big companies. And it's, kind of like putting your information out there to be used in ways that you are not probably consenting to. And so again, that may feel okay for you and it may not. And depending on the state that you might be living in, you might want to be more cautious around that, depending on what the laws are around your reproductive rights and health. But we really, really wanted an option if this was important to someone that worked, that was still like really valuable, and where you didn't have to, just to track information about your body, have to deal with this like kind of surveillance culture that we're in and have to figure out how to read and understand these consent forms, because it's impossible as an average consumer to do that. Like it really truly is. And so we just wanted to, if we could, take another piece of this kind of emotional labor that goes with becoming your own health advocate kind of off the table, so that if you want to do this tracking, you don't have to also become like a legal expert and, figure out how to protect your data, but you can just like record it in a book, and have that. So it's super important. And, I think Morgan and I, we like to, when someone is interested, really share our thoughts on this, but we don't always, because we really want this to feel accessible to everyone. But for us, it is very important, and it is political. And it's like, I think a huge part of us being in charge of our bodies is to feel like our data is safe.
I'm curious, in all of the research that you've done, after Roe v. Wade was overturned, we saw a lot of apps coming out and saying, no, everything is protected. Like, we have rewritten some of the fine print to prove that your data is protected. Is that true? I mean, my guess is that the answer is no, but I'm curious in your research if you've...
I would just say it's a pretty easy Google to see how many lawsuits there are about the false, advertising of those
claims.
Protective services. It's just not actually happening. Data is being bought and sold. It is being leaked. It is being hacked. Like it's not effectively protected, and there is no formalized way to do so.
Ugh, it's so scary. Yeah. Okay. Well, transitioning, I want to give you both a few minutes to speak to your expertise, your areas of expertise. So, Laura, I want to start with you and ask a question about sex, because I think this will be really helpful for our listeners. We talked about pleasure already, and I love all of the advice that you've already offered. But if you could just give us like a few quick tips for reigniting the spark, especially, I just came out of multiple years of IVF. I'm now postpartum. Sex feels like the hardest thing to even think about right now. And I know we have a lot of listeners that are in the thick of fertility treatments or going through infertility or postpartum as well. Any just like words of advice or quick tips?
Yes.
Yeah. 30, first, take all of your expertise in like 1 minute.
I mean, first of all, it's incredible, like what you've been through and, where you are, and everyone out there who's like in this journey, like, do not forget how absolutely mind-blowing it is that you're doing what you're doing. And to have things like sex be affected by that is not a failure. It is not something that you need to be like supremely worried about. It is just a byproduct of doing something really, really hard. And I like to just sort of like, anytime we're talking about something like this, remind us how our minds and bodies are wired. And to give the example of being in your house and you're like, getting ready to like maybe hook up, and, things are going well and you're feeling turned on. And then all of a sudden a bear runs through your door. And what happens to your mind and your body is not that you're like, okay, bear, give me 1 second. Like, things are going really well here. And I'm just going to like check in on you afterwards, because like, this is going to be great. It's not that. Our minds are wired to help us deal with the most concerning thing that we need to deal with. And then the rest of it is kind of going to go offline. That's an extremely simplistic way to describe this. But when we're talking about sex and how our minds and bodies are responding to certain scenarios, if we are dealing with something which is critical in terms of our priorities of what we need to attend to, then our minds and our bodies are going to focus all of our energy there. And actually the parts of our mind that's going to help us with arousal and desire, that's not going to be online. And so to expect that it would be to like expect something that our bodies would never do for us. So I just want to like level set what's happening in these moments so that we're again not expecting something that our bodies would not do for us. And when we're thinking about coming back into our sexual selves, maybe postpartum or maybe at different stages in dealing with infertility, to recognize that in order for us to access those parts of ourselves, we need the setting to like make sense for that. So times where we have a little bit of extra space to reconnect with ourselves. And a really good way to do that, I think, is to give yourself some runway before you might want to be connecting sexually. And when I say connecting sexually, I'm like using a broad statement because it does not have to be penetrative sex to feel good. We can talk about any type of sex here, any type of touch, from mutual masturbation to oral sex to using toys to like, not even focusing on orgasm at all, but just thinking about what feels good. So anything in that category, give yourself some runway. And when we say runway, often we're thinking about like foreplay as we were like taught in movies. And I want to say like, not even that. I mean, like 30 minutes or so before you're thinking about connecting with your partner, do something, read something, listen to something, watch something, think about something that turns you on. And you may want to involve something like, lube can be really helpful here, where you're just applying lube just to kind of like increase sensation in different parts of your body that you probably haven't been paying attention to, especially if you're in a postpartum context. If there is any type of like, maybe like a sort of lotion for the vulva that has been like helpful, again, depending on where you're at with like lactation, postpartum, stuff like that, like maybe applying something like that, not with the intention of like, again, like quote unquote foreplay, but just to bring some awareness to erogenous parts of your body and give yourself like 30 minutes of like no pressure. And again, it's not like you're like, okay, and now next is oral and then next is penetration. And then here's the position we do. And then we're wrapping up. And then, none of that. Like, let's like step away from the routine and just like spend some time allowing yourself to feel like yourself and to feel aroused and then go into it. So I would say like these are some like, I don't know, I think really reasonable things to do to come back into our bodies, because I know postpartum, that is not where we're spending time. I know when you're dealing with infertility, that is not where we're spending time. And I mean, quite honestly, anyone just in like a very busy, stressful, responsibility filled life, that's not where any of us are spending time. And so then when we go to have sex, it's not what we want it to be always. And that's because we're just like not feeling ourselves,
I love that. Thank you. Yeah, it feels very low stakes and approachable. And like, if it doesn't work, that's okay. Try again next time. And yeah, I love that. So thank you. Morgan, we have not had a midwife on the podcast yet. And I would like to do an episode, like a longer episode on this in the future, because I think it is really important and something that maybe is overlooked and not talked about as much. Infertility and IVF feels very much like complete once you get pregnant, like in the way that it's approached and looked at. And so I would love to hear a little bit about how a midwife can support somebody who has had maybe a more challenging time getting pregnant, or even like a traumatic experience leading up to pregnancy, why they maybe should consider having a midwife for their pregnancy and their birth, and the ways that you support people in that stage.
I love that question. I see this happen a lot. It's particularly difficult. I mean, truly with any, struggle with a fertility journey, but particularly with IVF, that by the time pregnancy is achieved, the process has been so interventive and so medicalized and gets jumbled into these ideas of like high risk and complicated and just really complex cases that you get to the pregnancy part and then it's like, okay, you're pregnant now, like now go be pregnant,
Like,
be
fly
simple.
away. Yeah.
Yeah. And you're like, what? What do
Yeah.
you mean I'm not going to get a phone call or have to jab myself with something every 3 days? I'm like, I'm
Mhm.
just supposed to like be?
Well, yeah. And especially when you're seeing someone like so
Yeah.
frequently, the discharge into like, okay, and now you just like see your obstetrician
OB
is
like 3
so
months from now.
Yeah.
terrifying.
In 12 weeks.
Yes.
It can be a really like mind trip, truthfully. I think, there are some, every provider is different, of course, but there are some basic themes in midwifery care that are actually really well suited to people who have had a more complex fertility journey. The basis of midwifery care is in truly understanding physiology, like how does the body function and work? And so it's having a really education focused style of care where someone is going to talk through learning how does your individual body work with your individual health history and fertility story. What kind of expectations can we put up throughout pregnancy care based on that story? And how can we support you switching your headspace if that feels good to, hey, we're into the regular, degular, boring pregnancy world, which is where we want to be. We're no longer in this highly medicalized model. We don't have to be if we don't want to.
Yeah.
Um, the midwifery model is really based on shared decision making. So it's typically not from an authoritative front. It's really about making sure that the client is steering the ship or making the decisions, but the provider, the midwife is there to I happen to be a person who went to a bunch of years of school on this subject. I'm a nerd. I like to update myself on the research and the evidence on things, and I can apply that information to you as an individual and then share a menu of options. This is what care could look like in all these different ways. What feels good to you? It really is about kind of bringing that empowerment back on, which sometimes, I mean, I see it happen left and right, can feel really lost in fertility journeys where it's like you get siphoned on this pathway and this is, these are the necessities and the interventions needed to be able to get back into that confidence of decision making is something I really love to do in care. And I think is so powerful to do in a little bit of unlearning when you're moving away from that fertility journey into pregnancy care. We need to foster people into parents, which is having the confidence to make those decisions and feel, you know, not just like they're throwing a baby and they're like, what am I supposed to do with it? By the time you're having a
Yeah.
baby, you should feel really confident and like, oh man, we've been parenting for so long. And I can now look back at that IVF journey or that fertility journey and see we've been developing those parenting skills this whole time. And I know that and I see that and I can use that moving forward. So oftentimes the midwifery model of care works really well in that just because of the foundation and the ethos of that training and physiology is really well applied to balancing out understanding when we use interventions for really great reasons to achieve all of our goals, how we can still come back into the body and follow, whatever pathway it is we're after.
And is that something that people can just Google, like midwife in my area, or is that something they should ask their OB for a referral? How would you
Yeah.
go about finding one near you?
I mean, Google's great.
Yeah. Yeah.
There's all different types of midwives. There's midwives that work in the community setting, that work at birth centers, that do home birth. There's midwives that work in the hospital. I think a lot of time people, if they've gone through a fertility journey, have the assumption that they need to work with an OB. An obstetrician is the predominant provider that works around birth care in the United States, but that's not the case around the world. Usually it's midwives that do that care. There's only a very small chunk of people that actually qualify as what we call high risk in pregnancy, where you definitely
Interesting.
want to work with an obstetrician. Obstetricians,
Okay.
they're
Interesting.
surgeons. You want that skill set on board for these high complexity cases. But depending on what research you look at, most pregnancies, even IVF pregnancies, can still qualify in this like, I don't know, it's like 75 to 95% of pregnancies are still just like normal. They're just
Yeah.
like physiologic events. They're not pathologies. They're not illnesses. everyone's care should be individualized. So when I work with IVF clients, I'm well aware that there are certain increased risks that come with having had an IVF pregnancy around like onset of labor and maybe postpartum. There's some slight tweaks and differences. So we individualize what people's care looks like. But that's something that should happen with any provider you work with, whether it's an obstetrician or a midwife. But just knowing there are options, and if you feel like you defaulted into one just because it was the first thing offered to you, people change their mind all the time. If it doesn't feel right in visits, just shop around, mix it up. No big deal.
I didn't know that. So I just learned something new as well. That's awesome. Thank you both so much for this conversation, for hopping on. I feel like I learned so much. I think our listeners have learned so much. And thank you again for just like for creating this resource. Tell us where we can buy it. Where can listeners find you, support you, get their own copy?
You can buy the book everywhere that books are sold. Hit up your local indie bookshop. And you can find Laura and I on our website. It's lauraandmorgan.com. We have lots of resources around our private practices there, as well as ways you can connect for workshops that we have for the general public and also for clinicians. And then we're also on social media with It's Laura and Morgan on Instagram. We love talking about this stuff, so shoot us a DM. We want to talk about your hormones and your cycle patterns. Hit us up.
Well, thank you both so much. And we are so excited to share this with listeners. It's going to be such a great resource. And I'm sorry that Amy couldn't join us. She's going to be so sad, but I know she's going to love listening to it. So
thank you so much for having us.